to a bar for a man who is confused.
What's his age?
30-year-old.
30-year-old male. Okay, BSI, is my scene safe?
It is.
All right.
There is a bartender if you need to ask for.
Okay, my number of patients?
1.
I'm gonna call for ALS backup. I can always cancel them if I need them. Do I need to take C-spine precautions?
Negative.
All right, so I walk into the bar. I see, my general impression is that I have one male, 30-year-old male patient. Is he sitting on a bar stool? What are my surroundings like?
He's sitting on a bar. It's dark, smoky.
Okay, so I'm gonna assess him for his ABCs. So is his airway open and patent? Is he, sir, are you okay?
Who are you?
Oh, sir, my name's Angela. I'm with the ambulance service. So okay, so I can see that his airway is open. He's talking to me. His level of consciousness seems like he may have an altered mental status. I'll look into that more. But his airway is open and patent. His skin is pink, warm, and dry. So I think that he is a stay and play for now. So, sir, how are you feeling today?
Fine, go away.
Okay. And there's a bartender?
Yep.
All right. Sir, has he been drinking a lot tonight, or do you know him?
Yeah, he comes in every so often. I think he's only drinking water, but I can't remember right now. I've had a lot of customers.
Okay. So why did you guys call for me?
Because he seems confused. He's kind of belligerent. I wasn't sure what the deal was. He comes in, once, twice a week. It's a little abnormal for him to be such a dick, but I don't know.
Okay.
So I figured I'd call y'all.
Okay. So, do you know any history about him? Like if he has any medical issues or takes any medications or anything like that?
I don't, but I have seen him take something with an M. I think it was met something before.
Met something, like maybe metformin?
Yeah, that's it.
Okay, so do you know if he has diabetes or not?
I have no clue.
Okay, that's medication for diabetes, so I'm gonna think that.
He did order a cheeseburger and some french fries, if that helps.
Okay, did he eat that?
No, they haven't come out yet.
Okay, so it hasn't come out. So you haven't seen him eat anything yet today?
Nope.
Okay. Sir, is it okay if I get some vital signs from you?
Yeah, I guess.
Okay, so I'm gonna have my partner take vital signs at this time. So, what are you doing today? Just hanging out?
Just hanging out.
Yeah. How you feeling?
I feel fine.
Yeah. You don't have any pain or sick or feel sick at all?
Nope.
No, just hanging out, having some lunch?
Yep.
Okay. What were you doing earlier today?
Does that work?
You were at work? Okay, so you've been here for about an hour approximately?
Sure.
Okay. And sir, do you have any medical history at all I should know about? Do you have diabetes?
Yeah.
You have diabetes? Okay, do you take insulin for it?
Yeah, I got it.
You have
Over
insulin?
here.
Okay. Are you type 1 or type 2 diabetic?
I don't know.
Okay. I'm gonna get a blood sugar on him right away. What did my vitals come back as?
Blood glucose reads low.
Okay, and my other vitals?
Your respirations are 16.
Okay.
Blood pressure 120/88.
Okay.
Pulse present
Okay.
and regular.
And his oxygen level?
O2 is at 98.
98%. Okay. Sir, are you okay if I put you on if I administer just a little bit of oxygen while we sit here and chat for a minute?
Okay.
Okay, so I'm gonna put him on a nasal cannula at 2 liters per minute, just to give him that extra oxygen therapy. Since his blood sugar is low, has his food come out yet?
It's coming out.
Okay, do you have a glass of juice that we could give
Yeah,
him?
we got some pineapple juice.
Okay, great.
Something like that.
Sir, would you mind drinking this pineapple juice for me?
Sure.
All right, let's see, because I think what's going on here is that you're having low blood sugars, and it's making you a little bit confused, okay? And I just want to make sure that you're safe. So, after he drinks the pineapple juice, do we see any improvement?
Slowly, yeah.
Okay, so he's slowly starting to improve. So, sir, I think what's going on is that your diabetes got a little bit low, and so we gave you some sugar. I guess I would, depending on the status, make a decision whether I felt like I needed to give oral glucose at that time or not. I would definitely keep him on the oxygen. I would advise him to go to the hospital. So are you okay with coming to the hospital and getting checked out? We can get your food in a to-go box?
Sure.
Okay, so I'm gonna get him into the ambulance. I'm gonna maintain his, checking his vital signs. I'm going to get a sample history from him, so I know his past medical. Do you have any other, medical problems besides diabetes?
No,
No, okay. And do you take any other medications other than metformin?
just the insulin.
And then the insulin, right, okay. Do you have any allergies and medications?
Nothing at all.
Okay, and, so when's the last time you ate? Cause you just had some pineapple juice, you haven't eaten your burger yet, but did you eat anything earlier today?
Yeah, I had breakfast at 6.
At 6 a.m., okay, and what did that consist of?
Eggs, bacon, and some toast,
Okay,
and coffee.
okay, and events leading up would be he was sitting at the bar drinking water. So I feel pretty confident in my decision. So we get to the hospital and I'm going to give my report to the nurse. I have a 30-year-old male who I was dispatched to call out for altered mental status, feeling confused at a local bar. When I went in, he seemed a little bit combative and definitely had an altered mental status and confusion. I spoke with the bartender who said he comes in a couple times a week, but he doesn't usually act this way. He hadn't had anything to eat yet, only a glass of water, nothing else to drink. So I checked his vitals. I had a blood pressure of 120/88, 16 for respirations, 98% on room air. I did put him on 2 liters of oxygen via non-rebreather, and checked his blood glucose because I assumed that he was, because the bartender told me that he that he takes a medication that he thought started with MET and with all the other signs and symptoms. I was thinking high or low blood sugars. So we gave him a glass of pineapple juice. We were waiting for his food to come. His food's in the box here with him. After drinking the pineapple juice, he became more alert and understanding and was better able to answer my questions. We then transported him. He told me that he has no other medical background besides the diabetes. He takes metformin and insulin. He has no allergies. His last oral intake was this morning at 0600. It was eggs, bacon, and toast, and then the pineapple juice that he had at the bar, and then he has his food here that we put in a to-go box. And so my impression would be that he had low blood sugar, and we corrected that with some pineapple juice and oxygen.